Hello everyone. I'm sure you're all feeling the impact of the ongoing effort in our fight against COVID-19, and I would like to take a moment to thank you directly and provide another update on the progress we are making across this state. I personally understand the effort that is being put in by the whole system, not just the extraordinary clinicians on the front line, but from everyone in corporate and administrative roles to those in our crucial support services and throughout the broader community. Thank you all for your continued commitment. This challenge has shown us how well we can work together as a team, and I am impressed every day with the progress we are making and the level of ingenuity, innovation and resilience I see in staff and the system everywhere. There have been challenges in recent days in accessing interstate flights for those in hotel accommodation, and we are working closely with all agencies, particularly WA Police, to get these people back home. Our COVID clinics have tested over 26,000 people and are continuing to report consistently low numbers of positive cases. As of close of business on Friday, there were 541 positive cases, 40% of which have come from cruise ships, and we have 377 recoveries. These are encouraging statistics, but we cannot afford to be complacent. This is the time where we must be vigilant and continue to ensure readiness for any increase in positive cases. This preparation is being aided by the significant expansion of the testing regime, which will now enable members of the community to be tested at private diagnostic pathology facilities with a GP referral. All patients will be tested under the recently expanded criteria that is currently applied at the 9 established COVID clinics across the state. We are also strengthening the readiness of each health service provider by improving volumes of critical PPE stock and increasing our clinical workforce through expedited recruitment and induction processes. Through the significant additional PPE and supplies we have secured recently, worth over $5.5 million, we are building certainty in our current stocks. And as of Friday afternoon, we had over 590,000 masks, 11,000 safety glasses and 55,000 face shields. I'm pleased to advise that we have also appointed infectious diseases specialist Professor Chris Blythe as the clinical lead for PPE. This role will provide crucial clinical oversight and advice on how PPE is used in the response to this pandemic. This coincides with the recently released policy on the identification and use of PPE in the clinical setting during the COVID-19 outbreak, which had extensive input from health services and clinicians, including infectious diseases specialists, intensivists, ENT specialists and anaesthetists. We have received feedback on this policy and will be collating this over the next week. From a health service oversight and coordination perspective, both public and privately, we have recently announced the appointment of Liz McLeod as the Chief Executive COVID-19 Health Operations within the State Health Incident Coordination Centre, or SHIC. This new position will ensure we have oversight of activities carried out by health service providers, private hospitals and other providers to support a whole of health system coordinated response to the COVID-19 pandemic. The response is not without its challenges, and we've seen some particularly difficult situations arise as we work to ensure the provision of healthcare in some of our regional and remote areas, which is being hampered by reduced air services. Can I assure you this is something that WA Country Health Services SHIC and we are continuing to work on every day. We are also continuing to work with private hospitals and providers across the sector to ensure we quickly utilise all the resources available as become required. Although this COVID-19 challenge evolves and changes every day, I feel confident that we are doing everything we can to remain agile and effective in our response, while using every opportunity to learn and improve from the actions we have taken to date. I'm proud of what we are achieving as a team every week across the whole WA health system, and I urge you to continue with your efforts. Please keep doing what you are doing because you are truly making a massive difference. Thank you again for your strength, resilience and commitment at this very challenging time.